Now let's turn to moral conduct, how children act as opposed to how they think. Specifically, we will examine prosocial behavior, which includes actions that society considers desirable and encouraged in children. Three forms of prosocial behavior that have been studied extensively are helping, which includes comforting and caregiving, sharing, and conflict resolution. It is widely believed that the roots of prosocial behavior lie in the capacity to feel empathy and sympathy. Therefore, we will begin our discussion of prosocial development with these topics. Empathy is the ability to indirectly experience or share another emotion state or condition. Sympathy is the feeling of concern for another in reaction to other situation or emotional state without necessarily sharing the same emotional state. Martin Hoffman's empathy theory outlines the development of empathy in 6 stages. Stage 1. Global empathetic distress. The first signs of empathy appear during the early months of life, when infants reactively cry upon hearing the cries of other infants. Hoffman points out that this is not simply imitation or a pain response to unpleasant stimuli. For example, newborns do not cry when they hear a recording of their own crying, nor do they react as strongly to equally unpleasant non-social stimuli. Instead, their crying is a reaction of distress in response to the distress of another person. Stage 2. Egocentric empathetic distress. Around 11 or 12 months, infants respond to the distress of others as though they themselves were in distress. At this stage, they feel empathetic distress but lack clear boundaries between themselves and others. Conceptually, they respond to others' distress by comforting themselves, such as sucking on their thumbs or seeking comfort from caregivers. In these first 2 stages, infants cannot yet feel true empathy because they are unable to differentiate the distress of another from their own feelings of distress. However, their responses are still contingent of the distress reactions of others. Stage 3. Quasi-egocentric empathic distress. As children develop a sense of themselves as distinct individuals, their reaction to the distress of others changes. Midway through their second year, infants' sense of self becomes clearer as seen in their ability to recognize their own image in a mirror. Around this time, when confronted with someone who is distressed, they realize distress belongs to other person rather than to themselves. Conceptually, they respond by kissing, hugging, or otherwise trying to help. However, they have difficulty distinguishing between their own thoughts and feelings and those of others. As a result, the help they offer often reflects what they would like and not necessarily what would be most helpful to the other person. For example, Hoffman described one toddler who responded to a crying friend with a sad look, then gently took the friend's hand and brought him to his own mother, even though the friend's mother was present. Nevertheless, during this stage, children respond out of a sense of sympathy for the victim rather than just to alleviate their own empathy and thus distress. Stage 4. Predictable empathy. As children move to their 3rd year, they come closer to feeling what others are actually feeling. They now understand that other people have inner states, thoughts, feelings, and perception that are different from their own and can offer more appropriate help and comfort. However, the understanding that emerges during this stage is not always put to its best use. For example, a child might understand very well why a sibling is distressed and how best to comfort her, yet choose to do the exact opposite. Stage 5, Empathic distress beyond the situation. During middle childhood, children begin to consider the broader aspects of other people's life. They can empathize not only with those currently experiencing distress, but also with individuals they imagine to have generally sad or unpleasant life due to illness, poverty, and similar conditions. Hoffman describes this as a mature empathy, which involves responding to multiple cues, including the emotional expressions of others, their behavior, their immediate situation, and their overall life condition. Stage 6, Empathy for distressed groups. The highest level of empathy emerges in adolescence. At this stage, due to their developing abstract reasoning abilities, youth can empathize with the plight of entire groups of people, such as the homeless, social outcasts, and victims of war or disaster. This form of empathy motivates some adolescents to take action to help those in distress groups through policy making, outreach work, or social activism. Research on early helping behavior aligns well with Hoffman's six-stage theory of empathy development. As Hoffman's theory suggests, when young toddlers encounter someone in distress, they often become distressed themselves. However, many older toddlers try to help the person in need, even if their attempts aren't always appropriate, like the child who tried to feed his cereal to his sick father. As children grow, both the frequency and the sophistication of their helping behavior increase. Older children are more likely to express concern verbally, fetch a bandage or a blanket, or ask an adult for help. Helping behavior actually increases with age. Compared to younger children, older children and adolescents are more likely to help even at a personal cost. This might be because they better understand the potential physical, psychological, or moral benefits of helping others. Sharing. Sharing is another prosocial behavior that fascinates both researchers and caregivers. We all know that young children don't always share easily, but sharing actually starts quite early. By the end of their first year, babies often hand a toy or some food to their mother or another child. Sharing serves many interpersonal functions. For young children with limited verbal skills, sharing is a way to start or maintain social interactions with adults or peers. It can also help children resolve conflicts among themselves. Kids are especially likely to share when they have a give and take relationship with the other person and have experienced both giving and receiving. Conflict resolution. Conflict resolution is another important type of prosocial behavior. Conflicts among peers and siblings are quite common during childhood and adolescence. Since many of these conflicts happen away from adult supervision, kids need ways to manage their disputes without letting them get out of hand. Conflicts can be resolved in various ways, which can be grouped into three broad categories. 1. Negotiation and compromise. These methods aim to reduce conflict and often lead to positive, constructive outcomes. Disengagement. This occurs when there is no resolution to the conflict. It includes actions like walking away from the dispute or changing the topic. Coercion. This happens when one party gives in to the other's demands, often due to threats, power assertion, or other negative tactics. The use of these strategies changes with age. Young children mostly resolve disputes through coercion, using negotiation and disengagement less frequently. Adolescents tend to favor disengagement, followed by coercion and then negotiation. Young adults, on the other hand, strongly prefer negotiation and use coercion and disengagement less often.